Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Children play sports, and I don't see Miss Stevenson today, but her grandkid suffered a concussion and was out of school for a while. And there's a lot of talk about, and many of you are teachers, so the question is, how soon should they go back to school? And the recent feeling is that they shouldn't stay out of school for longer than 3 days, and that as soon as they have a concussion, they should leave the activity and be examined by a healthcare professional to find out if they actually have had concussion. They also talked about the fact that one concussion, and we'll have an article that addresses this, is can damage the brain, and then repeated concussions can result in you getting brain damage affecting you at later age. And so as we have our children and grandchildren to have concussions, as we have young athletes who love sports and especially football and basketball and even rugby also, and they get head injuries, that it's important that they rest for a day or two, but then the sooner they get back to school, the better off they are. So that's just something to keep in mind as you deal with your children and great grandchildren and great grandchildren, I guess. And if your teachers have any comments on that in terms of, for a while they were keeping me out of school for a significant period of time, but the studies now show that the sooner they get back to school, the better, recognizing that a day or two may be appropriate, but longer than that may not be. Any thoughts from
Dr. Callender, as you well know, unlike medical doctors, teachers have no voice and say about children, not even the curriculum that we teach. All of that's made by school board and people, sometimes not in education, and the health profession, sometimes it gives suggestions, but teachers, we very rarely have any input as to the policies that they set forth for children.
Okay. All right.
Question, is Muhammad Ali an example of what your quality of life could be like if you continue to have repeated head injuries?
I don't think so. I think many of those who have the concussions are much worse than Muhammad Ali, because he actually developed Parkinson's.
Oh,
disease.
that's right.
He developed Parkinson's disease, and they had difficulty associating that with the trauma that he got from the boxing. But I think the better examples are those people in football who actually committed suicide or became very, very, they had dementia of a different kind of thought that's related to the brain damage from that. So
I forgot about his Parkinson's. Thank you. I'm sorry.
Yeah. Yeah. Any other comments or thoughts about that?
There's the Jackson, is it Jackson? No. The Dolphins quarterback, Tua Tagovailoa, has had repeated concussions already, and
He should stop playing.
a lot of people are very, very, very concerned about him. The money becomes more important than health.
Well, as we all know, money is not more important than health. Very few things that are more important than health. Your spiritual life may be more important than health, but very few other things, and certainly not money. because you're not going to be able to spend it if your brain is damaged.
I consider spiritual health as part of health.
Yeah, well, okay, it is part of health. But I was saying that there are not too many things that trump health.
No pun intended.
Uh-huh.
Yeah, right. Okay, why don't we start we also have one of the graphics on this as well. This is something that we have been aware of, but this study points out that we spend more than anybody else, but we rank last in health outcomes in the developed countries, not comparing them with developing countries, but comparing them with countries that have developed. And we're in that category, and we spend more than most other countries, but we are in the bottom of the list, which is not good. And what is the remedies? And I think that what we talk about, we're at the bottom of the list. The question is, what should we do about it? And they talk about the avoidable deaths, assault, infant and maternal mortality, which we do poorly with. And then, of course, as Darryl has talked about many times, our propensity towards obesity. It was interesting, the area we didn't have the worst outcome was in suicide rates. I thought we would be at the bottom there too, but we ranked third. The worst suicide rates were in Japan and in South Korea, which is interesting because I wouldn't have predicted that, because that's also the country that has people who live the longest in Japan. And South Korea, I don't know, but it's interesting how South Korea was even much higher than Japan, which is wonder why that is the situation.
Yeah, my guess is that in both of those cultures, Japan and South Korea, there's a culture of dishonor that if you do anything to embarrass, dishonor yourself, that the remedy is suicide.
Yeah, maybe, yeah. Mhm.
I learned about Harry Carey, early on. I never even thought of anything like that in America, but reading about Japan, they had it all the time. The suicide bombers, the kamikazes.
Yeah,
There's a lot of that in their culture.
yeah, good point. Yeah,
Doctor, I was wondering, Kevin, there's so much a push for success in Japan. If that also puts a lot of pressure on people.
yeah, especially as Darryl said, if you don't succeed or you bring dishonor, then
Oh, okay, I didn't hear it. Okay, yeah.
yeah. Okay, I think it's well. We talked about the solution though, and I think that sometimes we forget that the solution is in our hands. One of the things that all of those countries have is universal health, and we don't have universal health. And I think it's high time. Of course, all the efforts that Obama made were negated, but it's time for us to recognize that one of the greatest impediments to, and one of the reasons why we're at the bottom is because we don't have universal health. At least that's what
Well,
we think.
on the
Thoughts.
other hand, the United States has the best government that money can buy, and money from the insurance companies has already bought the politicians. And so, as long as you have, that part of healthcare privatized, you're not likely to ever get universal healthcare.
Well, I think it's what you say is true, but I would, and I believe you're right, but I would fight aggressively towards trying to get it. But the fact that we nearly had it, but the money talked and stopped the Obama program from doing what it was already accomplishing and is still accomplishing. Uh,
Well,
so
money doesn't have to buy all the senators, it only has to buy 51.
Oh,
yeah, that's the problem. Yeah. Well, any thoughts about the President's State of the Union address impacting universal health down the road? Maybe the reaction by Republicans to his address suggests that Darryl is right and they'll never get together on anything, which is unfortunate. But I thought I didn't because it's food for thought. Now, this is something we've talked about for some time, that incompetence in medicine has no age limit. In other words, because somebody is over 60 doesn't mean they're incompetent, nor does it mean if they're under 60 that they're competent. And so that what is important is to have people evaluated and recertified and identify that their skills are still in place. And then as long as they're competent, the age limit becomes irrelevant. Although one can argue that if you're a surgeon, a neurosurgeon, that it's more important that we test your competency as you age. But there is no direct relationship. Remember, we talked about the 100-year-old doctors who are still practicing, and they opined about the experience and wisdom that comes with age, and why some people would prefer the older doctors. Yeah, yeah. And this statement is similar to some that you guys have made. All right. So, any comments about that? We've talked about it a couple of times, and just thought it'd be interesting to get another perspective on it, which is that age and competency are not necessarily aligned.
Dr. Callender, I would think that surgery is in a separate category because performing surgery is so intricate that your hands have to be steady, and it can't be any age-related situation where your hands aren't steady as they were when you were younger.
The interesting thing about that comment is the fact that with robotic surgery, that no longer is a problem because the robot is doing a lot of the surgery and the robot has no tremor. But your point is well taken, except for the fact that with the advent of robotic surgery, the surgeon's tremor becomes less of an issue.
I had a question, Doc. Are there competency like every 4 years exams or tests that doctors have to take?
No, but there are requirements, but there are none that require you to have competence test. For example, we every 2 years we have to have a certain number of take a number of courses to keep up to date with what's going on. And if you don't do that, you don't get your license renewed. But there is no requirement for cognitive tests that evaluates your ability to do whatever you are alleged you're doing, whether it's neurosurgery or those kind of things. So as long as you get your CME credits and your doctor says that you're okay, that's about it. So this is asking that we should have competence testing, not just getting CMEs, but actually find out if you're able to do what you are supposed to be doing, and whether your brain is functioning, whether your hands are still capable. But I just point out that as we have more robotic surgery and robotic surgeons, the tremor of the of the aging surgeon becomes less of an issue.
Dr. Callender, doctors have to take recertification classes, and teachers do too.
Well, yeah, as I said, but they're not. And that's a good point. That people who have received their degrees in the last 10 years are required to take recertification examinations. Uh, uh, so, and that is true. But that does not. I don't believe that tests your ability to be a doctor. It tests your ability to take exams and to read, but it doesn't tell whether you're still capable of doing what you need to do. And so we need specific competency examinations that identify whether you are capable of doing what it is. Because I think your teacher recertification examinations, do they test your ability to teach?
No,
Oh,
On the other hand, every 6 years, I have to be recertified as a professional registered parliamentarian. And you have to go through the process of, if you're at a meeting, what to do. You have to give presentations. You have to really prove that you can still do the work of a parliamentarian.
Well, that's the kind of thing that we should have in other fields. We don't really have that in medicine yet, and that's the test that they take that just shows that you read and you memorized everything, but doesn't really demonstrate that you are really competent. But I guess it's a step in the right direction. But
And if you're a professional musician, you don't have to take anything.
well, yeah, that's true. Does it matter?
No, it doesn't really matter, because your incompetence will show up when people stop calling you for gigs.
no, that's right. As a diver, my local club recertifies every year, which is safety first and all that. I mean, you're diving with a tank of air on your back, go down to 100 feet, below the surface. I mean, anything can happen. So to keep your skills up, but the professional dive um, trainers and teachers now are recommending for all divers to recertify every 2 years, even though if you get certified as a scuba diver, you're certified for life. There's no annual requirement, but now they're saying that for safety, it's recommended to do it every year, every 2 years. So it's a similar sort of situation. I mean, your life is at stake.
Yeah. Okay. Okay. All right. Let's go on to the next one. Now, this is a controversial Massachusetts bill that I think is unethical, frankly. Uh, the bill the bill would allow incarcerated individuals the option of donating their organs or bone marrow in exchange for reduction in their sentences, which is in many ways something that borders on, to me, is unethical. Yeah, because it gets to the point of almost exploiting somebody just to get the sentence reduced to donate, and it's not doing something that they really want to do. They're doing something that they're forced to do in order to reduce their sentence. And so it's going to be interesting. It was introduced. Now, question is, will it pass and will the state actually allow it to happen? And of course, the reason is because 20 people die every single day because of the shortage of donors. And so we have to use drastic measures to try to do this, but we shouldn't let that slippery down the road of exploiting people because of they're in prison. And so, and it should be purely voluntary as far as I'm concerned. But and then of course, the people in prison turn out to be Latinos and blacks. So it's particularly geared to us. So I would be opposed to it because I believe it's unethical.
Dr. Callender, I would think that people who have a life sentence would be interested.
They might be, but anyway, the question is this ethical? What are your thoughts about it?
I think it's unethical too, except for those who have a life sentence.
Didn't we hear something
Still-
about
It's still
China?
unethical for them too.
Didn't we have an article a couple months back about China? And
Yes.
or what? Remember what it was? What they
Yeah,
were doing?
yeah. They if you were on death row, they used you as a donor.
Period.
There wasn't any
Yeah.
choice about it.
Right.
But they didn't reduce the sentences. That's the problem.
Well, no, that's not the problem. They didn't reduce the sentence. Period. Yeah. Yeah. They just
Yeah,
exploited you.
I'm saying
Right.
that. Yeah.
They exploited you, and it's something that only is going to affect primarily blacks and Latinos is doubly unethical.
That's a key to get out. A lot of them are not over frivolous or something insignificant, or the ones like they just released all the people that were in jail for a law that's being passed about having small amounts of marijuana. If you're in prison and it's unjust, the majority of us are black. What's wrong with a get out card? Since the majority of them are in there, not majority, but a lot of them are in there about injustice anyway. So give them what, because a lot of times, and I could be wrong, a lot of times they're not being rehabilitated anyway, and that was supposed to be the main point to rehabilitate someone. So if they get out by doing their giving an organ to help someone else live, I don't see, they're volunteering. They're not being coerced, unless you're saying coerced, you get out of jail early. And I don't see anything wrong with that.
Well, it's unethical.
Why?
No, I don't think so.
It's unethical because you are taking advantage of something that is an unfair system, and what you're doing is taking advantage of the fact that they're in jail, and so it's not really something that they're doing on a voluntary nature. They're doing it because they want to get out of jail, and I think that is unethical.
Well, I know of a situation. I have a friend that went down to Alabama to work in the jail system. There are women in there serving 5 to 10 years of jail time because they stole a loaf of bread because of their system. Now, if you in a system like that, no justice, and someone gives you a chance to donate one of your organs and you still can live and get out because of an unjust society, and they finally giving you some way to get, other than that, she's got to stay in there 10 years, and because of equity, I don't understand. She has no get out card for stealing a loaf of bread, because she's got to serve 10 years because she's in a state that has this cruel and unjust punishment because she's black. Now, and then we don't want to give her a chance to say, you can get out. I don't see. What's wrong with that?
Well, the exploitation comes.
Huh?
Any other
I
thoughts?
think it's unethical too,
Yeah.
because
Well,
you
the
could use
article.
that. You could use that if children want to get a scholarship to college. If you give me a kidney, we'll give you we'll pay for your college education. It could just morph off to other things. I think it just be the beginning of what it could be, and that could be a force. It's all. I don't think you should have another child when you have a child that needs to have a transplant. You have a child that has an illness, and then you're gonna have another child to be a donor for the child that you have. I'm not too. I don't. I have problems with that concept. So no, I don't think they should get into that.
Any other comments?
The only comment I have is that it depends on whether it is voluntary or like in China when you don't have any choice.
Elizabeth, you had your hand up?
Yes, yes. Again, good morning, everyone. When I hear us discussing this, the first thing in my mind is sacrifice, sacrificing your body. Okay. And then we know the biblical sacrifice of the most precious lamb that sacrificed his life. But going in another direction, before 1865, we know we call it a different name. Mass incarceration was called a different name because my grandmother, my grandfather, they always had me in the house to do things for them while everybody else was playing. And I heard a lot of stories, and I heard it was called by another name, but it was still called mass incarceration. It was when the plantation owners, people were freed in 1865, but the plantation owner, when it was crop time, the law of that land and the plantation owner of that land got together and did trump up charges on Black Americans and put them in jail, and some of them, and they kidnapped a lot of them, because my grandmother used to talk about it. And that was mass incarceration, because some of them never came back. Some of them died. And then after 1865, we know that the United States at first was trying to protect the free enslaved people, but we know that the southern states deal with the United States to take the military out of the South, which evolved another situation where they were mistreated and abused, and mass incarceration began again. Now we call it another name in our present day time, but it's still mass incarceration. So, sacrifice of your body for that, I don't think sacrifice should be, because of all the sacrifice that has happened under the umbrella of mass incarceration. Thank you, Dr. Callender.
Thank you. Janice, you had a comment? Janice, I saw you before. Did you have a comment? Okay. Any other comments? If not, we'll move on. But I think it's food for thought, and we've heard a number of takes on it, which is good to hear. This is progress and unheard of before, as to restore impaired kidney function by blocking interferon. I'm sorry, action of actually interleukin 11, which is supposed to enable damaged kidney cells to regenerate. Interleukin is a cytokine that is released when you have interaction between antigen and antibody. And this cytokine that is released appears to restore kidney function, which has never been done before. And I just call your attention to it because what happens is that you get fibrosis, inflammation, scarring, and loss of function. And so they found that inhibiting this antibody can actually reverse kidney damage, which has never been done before. So if this actually can be repeated and continued, it has promise for people who have kidney disease, whose kidney function could possibly be restored. Now, this, of course, hasn't happened in the human yet, but it's something that may lead to an ability to reverse kidney disease, which once you get to stage 4 or 5, it's not reversible. The first 3 stages are reversible, but at stage 4 and 5, it's not reversible. So this leads one to think that down the road, this could be the treatment for chronic kidney disease. Time will tell, but anyway, we've come across some things early on that turned out to be game changers, and this is something that has the potential. Because right now, the only treatment for stage 4, stage 5 kidney disease is dialysis and transplantation. Any comments or thoughts on this subject? Let's go to the next one then. Very problematic, this article. Women 65 and older dying from cervical cancer. We talked about the fact that even after you're 65, there's still a reason to get vaginal examinations. But people who are not getting pap smears after 65 anymore, and they're not going to the gynecologist anymore after 65. And we still have 20% of the people who are dying from cervical cancer over 65. It's indicating that just because cervical cancer screening is stopped doesn't mean you stop seeing your gynecologist after 65. And there was a time when that was thought to be the case, but that is no longer the case. You get a vaginal exam, but doesn't mean that you if you have you take the vaccine and you don't have exposure to the virus, that's good. But there's also uterine cancer as well as cervical cancer that kills older women. And this is the virus that the vaccine is used for. And so if you're HPV negative, the thought is that you don't need to get a pap smear anymore, which is correct. But there's many people who have not got the vaccine. And those are people who are subject to this virus, and therefore this virus can cause cervical cancer as well as oral cancer. So the question is, are current screening guidelines weren't falling short? And I think my answer would be they are, in the sense of suggesting that women over 65 don't need to get any more examinations by gynecologists. You still need to be evaluated by a gynecologist after 65. And that's the area that I would think is important.
I had a question, Dr. Callender. They mentioned pre-cancer. How do they determine pre-cancer?
By getting a pap smear. By getting a pap smear, you can find out early on whether the cells are likely to become cancer. And that's why they did the pap smears as well. And this talks about the late stage treatment, which is chemotherapy and radiation.
Yeah, the HPV vaccine, men and women up to age 45 can get vaccinated. but I guess that's the limit. So should people over 45, should they get screened for HPV and so that they can take precautions?
Yeah, yeah. Well, that makes sense. Uh, and if they are not HPV, if they have not gotten the vaccine, then it is likely that they do have the human papilloma virus, and therefore they can come up with cervical cancer. So that the HPV testing would be one way of identifying whether or not this person is likely to develop cervical cancer.
Dr. Callender, where does it show up in men?
Oral cancer, throat cancer,
Excuse me?
throat cancer,
Yeah, like Michael Douglas.
right. Mhm. Good example, yeah. Throat cancer, laryngeal cancers, yeah.
Yeah, well, I'm surprised that it doesn't cause any cancer in the sex organs in men.
Oh, no, it doesn't. But the only place is the throat for men, yeah. Okay, let's go to the next one. Now, this is an article that talks about the potential of bird flu affecting humans. There's no evidence that it has reached us yet, but it has spilled over to other mammals. Thought is that if it can spill over to mammals, why couldn't it spill over into humans? And so they found it in skunks, bears, raccoons, and red fox. So they're wondering if the next step is for it to, and we talk about xenozoonosis, which is where you get virus from other species, from one species to another. And this then would be an example of it. But so far, we have not had this bird flu getting into humans. And the way that you get it is by eating the animals. And there's been no evidence, however, that this has happened yet. But they are fearful that it can. It's not going to be found in eggs, but if someone were to eat a bird that had the disease, would it cause bird flu in humans? And these would be the signs that you would have, which is almost like what we have in the many other diseases.
Sounds like another positive for being a vegan.
Yeah, yeah, yeah. Another one, right?
Dr. Atto has his hand up.
Yes, Dr. Callender, will somebody easily get this flu from the birds, even though the meat is thoroughly cooked?
I have no idea. I don't know. I don't think we know yet. So
Yeah,
we
I
would know
asked.
if they actually did tests on that, and they haven't done that yet. So
Okay. Because in Africa, especially in Nigeria, there's a season where the chickens they just develop this or get this flu or this virus, and then you see the chickens dying. You just see them, bending their head down and immobile, and people will rush. The family members will rush and get the chicken and kill it, and then cook it and eat it.
Mm.
Yeah.
in the United States, if they find that, they would kill the chickens.
Yes,
They wouldn't allow it to be eaten.
consumed.
They wouldn't
But
allow it.
Yeah, I heard that they had already killed over 5 million chickens.
Right.
mhm.
that
Right.
had the
That's how they
disease.
eliminate it. Right. Mhm.
Yeah,
And also, I just heard that the World Health is about to go on alert for this virus, for the bird flu.
Okay. Let's go to the next one. This is something that's positive, that booster doses reduced COVID-related mortality in patients who have multiple morbidities, and with a greater than 90% decrease in COVID-related deaths. This is good news for those who are vaccinated, and not so good news for those who aren't vaccinated. Since I guess everybody on this group is already boosted and vaccinated, it's a good news for us. And they got enough data now that they can identify the merit of the vaccinations and the boosters. And by now, most of us have gotten what, five doses, 2 initial and 3 additional boosters. Ms. Brooks, you had a comment? Okay, all right. So next slide, I think this is something that's very good to know. Vaccination saves lives, yeah. Yeah. This is an interesting article because we're now getting more and more articles that recommends reducing or eliminating alcohol consumption. And when you talk about temperance, the Bible talks about that being important. And what is interesting is that no drinks per week has benefits: better health, better sleep. 1 to 2 drinks will not likely have alcohol-related consequences, but 3 to 6 drinks and other cancers. 7 or more increase the risk of heart disease and stroke. Each additional drink increases the risk of other health consequences. And it's not like we didn't know that alcohol was dangerous. I mean, alcohol is addictive, but yet we have legalized it. But now we're getting more and more evidence that alcohol is unhealthy. And I can't see the surprise. The difference is that alcohol makes money, so we legalize it. So, but there's evidence that at least 7 types of cancer are related to alcohol drinking. And I think these points here are important, especially those who don't drink it. For those who drink, those who don't drink at all, it's not an issue. But those who drink, these are the amounts that seem to be safer. Says it's health risks increase more steeply for females than males. And then, of course, the other associations with alcohol. But what is interesting is that it's fearful to come out with these statements because the alcohol industry becomes very frightened, just like the rifle industry when we talk about violence and restricting guns. So you got a situation where money is the big issue that obscures the risk. And just like with nicotine, which is addictive, all nicotine packages demonstrate the association for cancer, but I haven't seen any alcohol drink that suggests that cancer is a complication. And to suggest that probably would have financial consequences. Any other thoughts about that? Any of you think about?
Dr. Callender, is there any study done on the season where people tend to drink more? Because I heard that people tend to drink more in the winter time than in any other time. I don't know
Oh,
whether that is true.
I've not seen any study on the season.
Okay.
Darryl, have you? I haven't seen any study on.
No, I haven't.
Yeah, I haven't seen anything on
Yeah, but I can tell you that heavy drinkers drink heavy all year long.
that. Yeah, that's probably. Okay, let's go to the next one. This is because some people have thought that potatoes increased the glucose level, and some even thought it increased the blood pressure. And so these studies suggest that they don't interfere with insulin resistance and do not increase the risk of type 2 diabetes as has been assumed. And they also don't cause you to gain weight, they say. So those of you who like a fairly inexpensive vegetable, potatoes are something that you can incorporate into your diet.
Does that include white potatoes?
Well, of course, we know the healthiest are the brown potatoes and but
Sweet.
yeah, sweet potatoes are very healthy, but white potatoes are valuable as well.
Yeah,
And
and some people think that red potatoes are better than white, but actually, nutritional value is about the same. So there's really no difference between white and red.
Okay.
Okay, thank you.
Is that the red potato? Is that what they call yam in America?
No, yam is a sweet potato.
Yeah,
Oh,
yeah,
okay.
yam is yeah.
Okay. Thank you.
Now this I thought it was a very important study because those people who have kidney disease know that you have to get an injection periodically in order to prevent the anemia that goes along with chronic kidney disease. And so to have a drug that is oral and doesn't require injections is actually monumental. And so those people who have end-stage renal disease can now not need to take those injections that were part and parcel of all people who are on dialysis and who have end-stage renal disease. And so this is new drug is something, not everybody likes to get injections. And so it's now been approved by the FDA. Now, it certainly is not the case for those people who do not require dialysis, but especially those who require dialysis.
Dr. Callender, why does dialysis cause anemia?
Well, actually, dialysis doesn't cause kidney. Erythropoietin is a hormone that is produced by the kidney. And when your kidneys fail, the erythropoietin drops, and therefore your ability to have normal hemoglobin disappears. And so to overcome that, they give you the erythropoietin by injection, which then replaces the hormone that the kidneys no longer produce. And that's why with kidney failure, invariably you have an anemia because the erythropoietin that produces the hemoglobin and keeps your red blood cell count normal is deficient. And so this replaces it. And this is the erythropoietin, name of the hormone that the kidney produces that is no longer produced.
Mhm.
So it's a big deal. Okay, next. I remember we've had many talks through the decade about the blood pressure target. And it's been, I think, John Robinson, uh, when he was in the group, talked much about how we change every couple of years on the targets. And this talks about how we went from 140 over 90 down to 120 over 80. And what happens is when you go to 120 over 80, then that requires additional blood pressure medication. And these blood pressure medications have side effects. And so it makes a difference whether the target is 120 over 90 or 120 over 80 or 140 over 90. And so after many years of back and forth, they're now talking about going back up to 140 over 90, which is interesting. But when will it end? That's a good question because it's been cyclical for at least the last 10 years. But the reason that they change it is because the consequence of increasing the medication that will get you to a blood pressure of 120 over 80 is associated with some risk. Although it's small, it's still a risk. And this risk they felt was not worth it. And so they felt that you could go back to not requiring the 120 over 80. But the question is, how long will this last? When will they go back to the 120 over 80? So,
Dr. Callender,
yeah.
why does diastolic blood pressure decrease as you get older? The average diastolic. It seems like systolic goes up as you get older, but diastolic seems to decrease as you get older. And I was wondering
Well,
why that is.
it varies a lot because most of the patients that I see that have hypertension, they have high diastolics as well. But I don't know an answer as to why it appears that some people have high systolics but not high diastolics as they age. Because most of the hypertensive patients I see, they have high diastolics as well as high systolics.
Okay. Well, I just reading something where it says it gives average blood pressure ranges by age 18 to 39 years old, 119 over 70. But then 40 to 59, the systolic goes up 124 over 77. And so then the diastolic is going up a little bit. But over 60 years old, it says 133 over 69. So
That's
the
amazing.
69 dropped over when you get over 60 years old.
That's interesting. I've not seen that in my older Black patients. I don't know the population they're talking about. I don't know what's different for us, for older Black patients or not, but I've not seen that association.
Mm. Good morning, everybody. I'm in the process of getting ready to have hip surgery, and my blood pressure had been up. And so my doctor gave me blood pressure medicine to bring it down. And she also gave me a blood pressure machine to check my blood pressure daily. And it just fluctuated from 150 something to 130 something to one, just went back and forth. So, but now that I'm seeing this number here, I don't really feel like I need any blood pressure medicine, but I am taking 5 milligrams and I will take it until I have my surgery.
5 milligrams of what?
What is it?
I'm
AMLODIPINE.
Amlodipine. Oh, amlodipine. Okay. Yeah. That's the only one you're on?
That's the only one. And
Yeah.
I just got on that a couple of weeks ago
Okay.
after the surgery. So
Yeah. Well, we pray for your successful surgery. When is the surgery scheduled for?
the 20th of February.
Oh, okay. We'll be praying for you.
Thank you. Thank you. Please do.
Yeah. Okay. Next article then. We had talked about concussion early on, but this is a study, and it bothers me that it's the Brits, and whether it's applicable to us or not, it remains to be seen. But what they found is, especially, and it's interesting, rugby is more common over there, and this is the group that has been sued because their concussions and brain injuries. Rugby is very much like football. I mean, like the American version of football, except it's not quite as brutal, I think. But and they have the same kind of concussion and brain issues that we have with football, the traumatic brain injuries and concussion. And so they're pointing out the thing that we talked about earlier, that the more head injuries you have, the more likely you are to, as an older person, to have dementia. And so that the more injuries you have, it becomes cumulative, and they increase your likelihood of having progressively worse cognitive brain function. And I guess the difference is that this is for older population, whereas the studies we talked about earlier were for a younger population of children who were preteens and teen ages. And the bottom line is that the more concussions you have, the more likely you are to have brain damage that results in you getting dementia. And this is something that we talked about a little earlier, in that people who have concussions and more than one concussion, that the more concussions you have, the more likely you are to demonstrate brain damage as you age and increase the risk of dementia. Any comments you want to make about this? This is something that we dealt with in the United States, and remember the Black pathologist who identified the association of the brain damage and the trouble they gave him for many years before they finally had to admit that this is traumatic brain injury that is the cause of dementia that was killing a number of the football players as they aged.
Dr. Callender, can you give us a definition of concussion? I mean, it seems like the brain runs against the inside, but
anytime that you lose consciousness after an injury, that is called concussion. That's about any time that you lose consciousness after an injury, that's called concussion. And so if you have one episode, it's one thing. If you have more than one episode, you're likely to have cognitive dysfunction later on in life increases. And so with the school kids, they had identified that if you have one concussion and you take time and give them a chance to recover and then go back to school as soon as possible, that the risks are decreased. But the more concussions you get, the more likely you are to have long-term brain damage as you age.
So generally, to have concussions, you usually do lose consciousness.
Absolutely, yes.
Okay.
But my question was what is it? Is it the brain banging against the inside of the skull?
It could be any of those things. The bottom line is though that you lose you black out, and because the brain is sensitive to rapid movements one way or the other, and as the article talks about, there's a number of symptoms that go along with concussion, including short-term and long-term, which include dizziness, headache, and as I mentioned, loss of consciousness. And the shorter the period of concussion, the less the symptoms, the less severe the concussion.
Yeah, that's why it's important to get observers involved, because the person who has a concussion may not even realize that they've lost some consciousness.
Mhm.
Good point. Okay. Norovirus, that's a stomach bug that can cause diarrhea and vomiting, and is contagious. And this is something that we haven't talked much about because we've been so talking about the coronavirus, but this is another GI virus that is contagious as well. And as you know, the new symptomatology with the coronavirus is to have GI symptoms with nausea, vomiting, diarrhea. And so when you have this, it's important to get it treated, and also to be able to treat the vomiting and diarrhea with medication, and also to replace the volume that is lost. It's common, but usually and here it says you accidentally get poop or vomit in your mouth, and this happens from different ways, and it talks about eating food that an affected person touches, and the same way you spread coronavirus, you spread it. Same technique, except that this is not spread by coughing. It's spread by touching contaminated people's GI products. And this talks more about some of the GI symptoms that are common, and I think most people have some of these at one time: with nausea, vomiting, diarrhea, stomach cramps, headache, a variety of these symptoms. And the treatment is also very interesting, because what happens when you have this is that you lose fluid. And so the way you prevent it is by hand washing, and also sanitization, the same thing we do for coronavirus. But the difference is that once you get this problem, the loss of volume is what causes people to get very, very sick, and can even die from it if you're not hydrated adequately. And this talks about the way to prevent it. The hand sanitizers and toilet seats and doorknobs are the same kind of things that we talked about with coronavirus, except you don't have the aerosolization that you have with coronavirus. Any comment? If not, the next, this is an interesting article that talks about omitting digital rectal examination prostate cancer surveillance. And I think this is a good article because it points out that digital rectal examination is important. And people want to skip it and do other stuff, but it's cheap. And as you go down on this study, it talks about the fact that you may not need a digital rectal examination if you have a prostate MRI, but a prostate MRI costs $4,400. A digital rectal examination costs the price of a latex glove and lubricant. So to me, there's little question that you should not omit a digital rectal examination. Of course, this article says a little differently. But actually what it says, if you're going to get an MRI of the prostate, then you don't need a digital rectal examination. But if you're going to make a diagnosis and you want to prevent or make an early diagnosis of prostate cancer, then the digital rectal examination is important. In spite of what they say, just the same. Similarly, PSA levels are important as well. PSA levels and digital rectal examination. This is much more important in the African American population than it is in the Caucasian population. And this is something that this article does not address.
Dr. Callender, if the urologist has the history of the digital exams, maybe 2 in the past, then they might want to just, I'm asking this question, the PSA test, they might want to do that going forward.
They want to do both. It's desirable to do both, but the PSA is a little more specific, whereas the digital rectal examination allows you to examine the prostate. But if you have an elevated PSA, then you may want to go ahead and get a prostate MRI, which then makes the digital rectal examination unnecessary.
Do you need a digital rectum examination if the PSA is below 1?
No, I don't think so.
That's what I've been telling my doctor.
Yeah, but he still does the rectal, right?
Yeah.
Oh,
And I'm 0.8. I don't need it.
Yeah. Well, I think that it's good to have a female urologist because their fingers are smaller.
no.
My PSA is slightly elevated, but it's still below 1. I was wondering,
How can you call that slightly elevated? That's not elevated.
huh?
That's not elevated.
Well, I'm looking at the graph over a period of time, and the graph shows a slight increase in my number.
That's different from saying it's elevated.
Okay.
Oh.
Yeah. If you're under 1, you're in great shape on PSA.
Right.
And the reason I'm concerned is my father and my son both had prostate cancer. My father had it treated with those implants, the
Radiation.
radioactive
Yeah.
seed, I think they called it.
Yes.
My son had the freezing. They use the liquid nitrogen.
Cryotherapy. Yeah.
Cryotherapy, right? So and I keep asking my doctor about it. Is the PSA test, is that expensive?
No. No, PSA is a good test and cheap, and it's the level of above 4 is what is suggested. Less than 1 is, but if you really want to get an MRI of your prostate, well, that's something else, but that's something that you do when your PSA is elevated, not something that you do
Are
PSA.
there any symptoms of
Any
prostate?
symptoms Prostate? Well, prostate enlargement, yes. You have increased urinate. You get up at night to urinate. That's probably the commonest symptom, that you get up at night to urinate. That's the earliest symptom. You get up at night to urinate, or during the day you urinate more than every 2 to 3 hours. Those are the symptoms, right? And early prostatic cancer usually does not have any symptoms. But benign prostatic hypertrophy, which all men are going to have if they live long enough, is associated with the nocturia and increased urinary frequency. And then, of course, if you have digital rectal exam, you're able to find a nodule in the prostate. Any other questions about this? And I think most people now are doing the PSA without the digital rectal examination, but I don't agree with that. I think you should have both. Now, of course, if you're going to have an MRI, then of course, then you don't need to have both of them. But anyway. But this is something that women don't have to worry about. Okay, we'll go to the next one, please. This is an interesting article that talks about Guillain-Barré risk with a Janssen COVID shot. I don't know anybody who's gotten the Janssen COVID shot, but the risk is not associated with the other COVID vaccines, but it is associated with the Janssen vaccine. And so they just pointed this out because there are those who think all vaccines are associated with this, but that was not true of the Pfizer and the Moderna vaccines, which most of us have gotten. But
Callender, was the Janssen also the same as or associated with Johnson and Johnson?
No, this is different.
Okay.
Has anybody got the Johnson & Johnson vaccine? Okay. Now, there was an association with the other vaccines for influenza and others with a slight increased risk of GBS, Guillain-Barré's syndrome, but not with these vaccines. Next article. Now this one I included just because it's, we talk about Star Trek and we talk about what's coming down the pike. We also now are doing robot surgery, video surgery, and interesting. We talk about the movies, and they have Captain America, Han Solo, and others preserved at low temperatures and then wake up alive. But actually, one of the things, if you have hypothermia, actually, or if you have, for example, what's the guy's name? The athlete who just had a cardiac arrest. For many people, when they have cardiac arrest or anything like that, or if they're in hypothermia, they put them actually in hypothermia and slow the metabolism rate to allow the brain damage and other things to go away before they actually wake them up. And this hypothermia has been very important to protect the brain after cardiac arrest. And these protocols that they use dramatically decrease the likelihood of having prolonged brain damage after cardiac arrest. So that often they're bringing somebody with cardiac arrest and put them in hypothermia for a day or two. And then as they wake them up, they've already protected the brain. And so this is commonly done now. The protocol is done and it works. So, and similarly with people who have hypothermia themselves, they keep them on that for a while because that hypothermia does help. So, and that's something that has played a role in decreasing the brain damage associated with cardiac arrest. Now we also have done a lot of artificial insemination and other things, growing zygotes, sperm and the egg, and growing human babies outside the womb, and there's fertilization to birth. And of course, we talk about uterine transplants now that have been done commonly. And because of the fact that mechanical ventilation damages, they found a way to use oxygenated blood. And they also have a system in which if you have severe pneumonia, where they use a system that connects the oxygen connects the blood to an oxygenated system so that you can get oxygenated without your lungs being involved. And so this kind of situation actually has saved many lives, in which if you have a bad pneumonia, you would die otherwise. They will sometimes take your blood and put it through an oxygenator and bring it back to you. And so people who would otherwise die have this artificial situation where you get oxygenated without your lungs being involved. And then finally, of course, the RNA system, which is what got us the COVID vaccines, is something that was perfected, I guess, 3 to 4 years ago. And we then used this technology to develop the first COVID vaccines, which saves millions of lives. And so these are some of the behind the scenes technologies that seem strange, but they are really changing our lives. Also, the CAR-T therapy, new field of immunotherapy that allows to take cancer cells, put them in vitro, and get them to produce immune cells that respond to the cancers. This CAR-T therapy, chemotherapy, immunology has resulted in saving lives from cancer. And so the research is playing a major role in addressing many issues, especially the cancer, heart, the lungs, and other things. So I thought that just to identify the way in which artificial intelligence and technology is making a difference in transforming our ability to survive. Any comments on this? Because I think these are things that are happening on a daily basis, on a yearly basis. We talked about the genetic screening and genetic testing long before it became popular, and before it got the Nobel Prize for the greatest chemistry Nobel Prize. So these are the things that are happening as we go. Any comments or questions about some of these?